Welcome back to Daytime Ottawa. A few weeks ago, we had Perley Health on the show talking about the fantastic campaign that they have, and we've invited them back because they wanted to share some new research when it comes to, care with those living with frailty. And here to tell us more about it, we are joined by the Director of the Centre of Excellence and Research Operations at Perley Health, Danielle Sinden. Danielle, welcome to the show. Great to have you guys back.
Thanks for having me.
Let's first of all talk about the centre. Tell us a little bit about the role that the centre plays.
Sure. Yeah. So the Center of Excellence in Frailty-Informed Care at Perley Health conducts applied research that focuses on the development of best practices. And really, the goal of the Center of Excellence is to optimize care and quality of life for older adults living with frailty.
Well, yeah, and that comes to the latest research when it comes to adults living with frailty, older adults, as you said. What is some of the latest research that you've seen?
Yeah, so we're really proud of a recent study that's coming out of the Center of Excellence focusing on our SeeMe Understanding Frailty Together program. So SeeMe is an approach to caring for older adults living with frailty, and it really focuses on the assessment and management of frailty in long-term care. So what's really unique about the program is that it was developed in long-term care and it's designed for long-term care. It really focuses on early and transparent communication with families and with residents so that they really have a good understanding of the health status of their loved one and then can make decisions about their care and their future goals of care in that context of frailty, understanding what those risks are of a particular intervention or course of treatment.
Danielle, when we say frailty, what exactly do we mean by that?
Yeah, so frailty is a medical condition. It leads to a decline in function and health. And people that are more severely frail are more susceptible to large declines in their health. So if they do suffer from a minor illness, they're less able to cope with that illness, and they're more subject to rapid declines in their overall health.
When it comes to sort of interventions, I guess there's some are more invasive, some are less invasive. I know you're obviously, looking at the less invasive, but what exactly do we mean by that? Like, can you give us an idea of some of those invasive interventions that we've seen in the past?
Yeah, so the SeeMe program revolves around, again, assessing the risks of particular interventions. So someone who is frail, let's say, and has a fall, one of the courses of treatment could be going to the hospital. But someone who's very frail needs to understand, and their families need to understand, what the implications of going to the hospital could be for someone who has that level of frailty. So the SeeMe program helps them understand those risks and take into account really their values and their preferences and their goals of care to help them make the best decision for them.
Caring for somebody that's living with frailty, that's quite a bit to take on. What is the impact on those caregivers that are looking after someone that is living with frailty?
Yeah, I mean, it's very stressful for caregivers, especially in the face of the pandemic. A lot of family members have had loved ones move into long-term care over the course of the pandemic. And as we know, this has been extremely difficult for long-term care residents and their families. SeeMe is one way, I think, that helps address that. It helps make family members feel as though they're included in the care that's being provided to their loved ones. And the research that we've done and the evaluation that we've done at the program really proves that we can do more in terms of providing person-centered care to residents that are in long-term care. And so we're really proud of this publication that's been recently published in the Canadian Geriatrics Journal that demonstrates all of the benefits of this program.
Yeah, and Danielle, I think there's probably misconceptions when people hear the word frailty. They probably don't, consider the fact that, these people are, that you can still be active. Because I'm watching some of the images, that we were showing, is that people with frailty, obviously it's very individual, I imagine, from each person. But, is one of those misconceptions that, that these are bedridden people and that they're not active any longer?
Yeah, no, frailty is very individual. And I think that's what makes the SeeMe program so unique is that it really takes into account those personal differences. Everyone's got different goals. They want, different courses of treatment. They want different things in their life, and they want different things as they get older and as they are facing end of life. So SeeMe takes all those things into account. And although frailty is associated with older age, not all older adults are frail. And there are things that can be done to slow the progression of frailty. And certainly, one of the goals here at Perley Health is to keep residents active and engaged so that we can help them live their best life for as long as that may be.
And I thank you so much for joining us, Danielle. And I just wanted to reiterate, we had Perley Health on before, a call to action. They have these ongoing campaigns. Visit the website for more information.